So the symptoms like how are you sleeping? How are your joints feeling? How is your energy? How are your blood sugars behaving? These are things to look very, very close at. I've been at pretty much the same level since day one with my estrogen. I've had it anywhere from 60 to 100. And again, this is definitely something to talk with your doctor. Hello, and welcome to Type 1 and Midlife. And before we dive into today's episode, I want to let you know that this is actually the beginning of a 3-part series inspired by one of the most talked about resources inside my book, Highs, Lows, and Hormones. Several readers have reached out and shared that the symptom hormone matching guide listed in Chapter 4 was one of the most valuable tools in the entire book because it helped them connect the dots between what they were feeling, what might be contributing to those symptoms, and what conversations they wanted to have with their healthcare provider. So the guide focuses on 3 key hormones that impact women throughout perimenopause and menopause. They are estrogen, progesterone, and testosterone. And rather than trying to cover all 3 in one episode, I've decided to break them up into a 3-part series so we can really explore each hormone individually, what it does, what each of them does, how symptoms may show up when levels are changing, how blood sugars may be affected, and what questions you may want to ask your healthcare team. And today we're going to focus on estrogen. And in future episodes, we'll dive into progesterone and testosterone. So be sure to stay tuned because each hormone tells a different part of the story, and they are all very important to understand. So today I want to take one piece of that guide and go deep on estrogen, how it affects almost every woman I work with. So why does estrogen matter so much? Well, many women only associate estrogen with those reproductive things, right? So we have been kind of trained and molded to think that estrogen was just about having babies and the womanly things, which it is. But it also impacts a lot of other areas of the body. So it is associated with our periods, our monthly cycle, our fertility, and menopause, because we think, well, when we're low on estrogen, and hopefully we know this, that menopause has kind of entered the picture, right? But estrogen also affects insulin sensitivity, brain health, sleep, our muscles, maintaining muscles, our joints, our blood vessels, our bone density. There's so many, our metabolism, all these things. And estrogen isn't just a reproductive hormone, as you can see by this long list of all the things that it helps our body to function better. It's a whole body hormone. I like the whole adage, I've heard this from other practitioners in the space, is that estrogen is life. It's the life hormone, and it's really interesting. I love that connection. And just a reminder, I am not a doctor, and what you hear today is my personal experience. I'm the contributor from my book, Dr. Vanessa Severa, who is a menopause specialist, OBGYN, and speaks very broadly on many topics, just like what we're going to talk about today inside the book. So make sure you get yourself a copy. Highs, Lows, and Hormones. It's available. You can grab it on Amazon. The link is right here in the show notes. So please consult your doctor about anything you hear on the show. So what low estrogen can feel like? So let's just kind of go through the list. And again, this is part of that hormone symptom tracker that's going to kind of point to this and that. So if this is happening, this could be the hormone involved. So have you ever looked at a list of symptoms and thought, well, that's me, right? So let's walk through some common symptoms and just to see how they're all connected. So physical symptoms like the following: hot flashes, night sweats, joint pain, dry skin, vaginal dryness, belly weight gain. So weight gain around the midsection, difficulty recovering from workouts. And those are the physical symptoms. Those are the things that can be very apparent, right? Well, what about the mental and the psychological symptoms? And here's some examples: brain fog, forgetfulness, difficulty concentrating. And then there's the emotional symptoms like anxiety, irritability, feeling less resilient, just losing that punch, losing that kind of that pep in our step. And then there are the blood sugar related symptoms. Now, these tend to be one of the first things we start to notice, especially in perimenopause, and that is increased insulin resistance. In other words, your insulin is having to work harder to do the same job it always did. We tend to have higher fasting glucose levels. That's when we're waking up in the morning. There's more variability, so there's more of a roller coaster. And overall, we're needing more insulin. So that can definitely show up, right? So we're seeing that on our trend graphs, our pump reports, having to need more insulin from doing what we've always done. So stop and ask yourself this: did your blood sugars become harder before you noticed the hot flashes? This is interesting because, again, everybody experiences different symptoms, different degrees of symptoms at different times. But I think the number one thing that I want to talk about today and emphasize, and this is what I do in the book, is paying close attention to what's changing and noting this. And many women will say, so when you ask, did your blood sugars become harder before you notice those hot flashes or waking up, in the middle of the night, hot and sweaty? And generally speaking, that is the first symptom, is the higher blood sugars. And when you purchase the book, you also get companion resources, just like the one that I just mentioned and the one that we're talking through today. And this will help you walk through what you learn when you are ready to apply it. And there is a climacteric scale. This is a symptom tracker. This is a form that you have access to, that you can access whenever you want, to help log and keep account of these symptoms, the same ones that we're talking about today. So that's just an amazing tool that you get immediate access to when you purchase the book. And it's listed on my website, and it's a whole library of resources that you have free and easy access to. And I just mentioned data to help understand your trends and drive your conversation with your doctor. This is all that is happening with these symptoms, is understanding, noting them, and then again, clear conversation to have with your doctor to follow up with, to find out what your next step is with, again, living better with diabetes when hormones are changing. So let's talk about what happens when estrogen starts improving. So again, whether or not you decide to get on hormone therapy, this is something I definitely advocate for. And we talk a lot about this and how to do this and how to get with a knowledgeable practitioner to take that step with your care. What I noticed when estrogen level was higher per that blood test so what improved for me was better sleep, improved insulin sensitivity, my joints were less achy. It improved recovery, feeling more like myself. And many women and doctors focus on the number. So we're looking at that level. Again, if you're getting your levels tested, the measure level of estradiol before hormone therapy. And once prescribed, and assuming your dose and delivery method is adequate, we just kind of walk away and say we're all good. But what matters most is the symptoms. Symptoms speak loudly. You know how you are feeling. You know what is different. You know what is not acceptable for how you want to live and operate. So the symptoms like, how are you sleeping? How are your joints feeling? How is your energy? How are your blood sugars behaving? These are things to look very, very close at. Make a mention of it. Note it, track it on that symptom tracker that I said that you have access to inside the book. And another thing to consider, I want to just kind of go back and talk about something that happened to me. So can you have too much estrogen? This is a question women rarely hear discussed, is really, what's the adequate level, right? So what's your sweet spot? Well, this is what happened with me. I've been at pretty much the same level since day one with my estrogen. I've had it anywhere from 60, the levels from 60 to 100. And again, this is definitely something to talk with your doctor, verify if this is your happy place with what levels you want to be at and remain at, and when the symptoms are really eliminated or mitigated. But this is really, really important. Again, a knowledgeable practitioner is going to help guide you with this alongside your endocrinologist, because this should be a team working with what you need, how it's working, and how your body's responding. So I decided, due to more joint and body aches that I was experiencing, I've had some lower back and tight hip flexors that I've been really struggling with lately. So I decided I was going to increase my estrogen cream. So it's a compounded cream that I get prescribed, and I wanted to just increase it a little bit. So I usually do one pump at night. So that is my routine. And I decided, and again, I talked with my practitioner about this, and she gave me the thumbs up. She's like, sure, this is your body. You know what you're doing. You know how to kind of titrate and take a little bit more just to see if I was going to feel any difference. So I did. I was doing my one pump, and I decided to do a little bit more. So about a pump and a half. And it's amazing when you can do this with the creams, you can kind of control what's coming out. And it's amazing how sensitive and how impactful, and in my case, absorbing this cream is on our skin. And I rub it on the inside of my thigh. So I went for it. I decided to experiment with this for 2 to 3 months. So I went, I mean, this was just recently, it was about 6, 8 weeks ago, got my biannual levels tested. I get them done twice a year just to see, out of curiosity, alongside all the other levels I get tested with my doctor every year. And my estradiol at this point reached 170 was the level tested. Now, my prior test, again, about 3 to 4 months prior to this, was at 80. So that's quite a jump. So this is what I was feeling. So this is the benefits that I noticed in that. Again, it was about 2 to 3 months time that estrogen was increased in my body, and obviously my levels went up. I was sleeping better. I was having better insulin sensitivity. So my need for insulin went down a little bit. I did notice this. And again, we have the data to prove all this, don't we? We've got the pump reports. We've got the CGM reports, seeing our time and range and all of that kind of getting easier to manage. I was feeling less discomfort with the joint pain. Things were getting a little smoother. So that was the good part. But what I also noticed, again, with that higher level, was I was feeling puffy. So I was retaining more water, feeling kind of swollen, a little more puffiness around the midsection. My breasts were more tender, or they were tender because they hadn't been tender before. And these are all signs of higher estrogen. And I was feeling more emotional. So again, all those things. And these aren't bad. This is not a bad place to be, but it was something I was noticing that I wasn't really comfortable with sustaining those feelings long term. So more in this case, so increasing my dose doesn't always mean better. So the goal isn't maximum estrogen. The goal is symptom improvement. So what I did, so it's real important to find your sweet spot. So I did decide, after getting that level down, that 170 was too high of a number. I didn't want to keep it at that level. So I decided to go back to my one pump per day, and to get those levels down into that range that I was doing really well at prior. So the experiment was an experiment, but I learned from the experiment, and I took that data, talked to my practitioner about it, and we decided, again, it was a shared decision making, that I was going to go back to my original dosing amount. And like I was saying, there is no perfect number. There's only your symptoms, your quality of life, your blood sugar response, your goals. And my sweet spot may not be your sweet spot. So again, if we have the liberty to talk with a practitioner about this and figuring out what is best for you, and to find out what that current range is. And again, you can look at blood level numbers if that's what you want to. But again, symptoms tell the story. I tend to like to look at both. I'm just a little more data driven, because I guess I want that assurance that this is the delivery method, my body's absorbing it, this is my dose amount. And so right now, my current range, my target range, is between 80 and 100. And why me and my doctor decided that that's where I'm going to settle in. And that is where I'm getting the most benefits with the least amount of other symptoms that I don't want to experience. Again, it's individual. It's individualized care and symptom tracking and patience. Because, and if you have time and enough wherewithal with understanding how important this is overall, it's really important you have patience with this. And again, a doctor that's going to walk the path alongside you. And here's some questions to ask your provider. Just if this is something that's coming up for you, whether or not you are taking hormone therapy or considering it. So, could estrogen be contributing to my symptoms? Again, too much estrogen, or maybe a lack of estrogen could be contributing to your current symptoms. How might estrogen impact my insulin sensitivity? What options are available? These are all great questions. How do we evaluate whether treatment is helping you? So that's a great question for the doctor. How will we measure it? And are they open and willing to hear your response and your feedback? And most importantly, your questions about all of this. So even if you've been feeling different lately, don't dismiss what you're noticing. It's very, very important. You matter, how you feel matters, and what you decide to take if you decide to bring hormone therapy into your protocol. Just remember that this is just one part of the hormone picture today. Today's conversation focused on estrogen, but in the next episodes of this series, we'll explore progesterone and testosterone, two more hormones, and they also play a major role in blood sugar management, metabolism, sleep, energy, muscle health, mood, and how we feel in our bodies as women living with type 1 diabetes during midlife. It's really important that we are in tune with that. And one of the reasons I created the symptom hormone matching guide in chapter 4 as a reminder of highs, lows, and hormones was to help women stop guessing and start recognizing the patterns and understanding how hormones are related to certain symptoms and how they're feeling, and to be able to tie that back and to track that back. Symptoms are not random. They're often clues that help us ask better questions and become stronger advocates for our health. So if today's episode resonated with you, make sure you're subscribed to the show so you don't miss the next two conversations and ongoing conversations that we're going to continue to have in here every single week. And remember, your symptoms are not something to fear or ignore. They're information. They're your body's way of communicating with you. And the more we understand those messages, the better equipped we are to support our health and live well with diabetes through every stage of life. I'm wishing you a beautiful day. Until next time.